And here we go.
And I'm going to just make sure we can all see a screen that says connecting for recovery. Yes?
Yes.
Okay. Awesome. Well, I'll go ahead and get started. So, Beth, thank you for the introduction and Aspen for the introduction icebreaker. I'm really excited to be here with you today and to share some research that I've been doing with the Phoenix for like 2 years now, which is bonkers to think about. And this is actually a collection of analyses that I've kind of summed together for you today. But the common thread is that it's the premise of connecting for recovery. This is an empirical assessment of social support experienced by Phoenix members, and I'm really excited to dive in. That said, I do need to give some shout outs before I get too far into it. First of all, this study was, or these studies were funded by a seed grant program offered through the Texas A&M Health Science Center. And so very thankful to get that resource so that we can conduct this work. And then there are so many collaborators and community members that I have to give a shout out to. First and foremost, doctors Katie Heinrich, Danny Valdez, and Tyler Prochnow. They're kind of my scientific team, and they helped me think through a lot of the study design and brought their expertise to the table throughout the course of the project. Allison Francis is my GA, my graduate assistant and doctoral student, and was my kind of second person in command on a lot of this stuff, helped me with project management, data cleaning, data management, that sort of thing. I also had an army of students who helped me conduct interviews. Some of you might have spoken to some of them. And then I have Phoenix people that I have to thank. So Mika in Denver, Cody and Suzanne in Wichita, who are kind of my people on the ground to execute these studies. And then over 200 participants from the Phoenix who shared their stories and their data with me so that I could even give this presentation. So huge shout out to all of these folks. Love an excuse to show off my family. So you don't really know me without at least knowing about them. So I'm Meg. That's my son, Beck. He's about to turn 8 years old, and my husband, Clint. I'm an associate professor at the School of Public Health at Texas A&M University. And my research expertise lines up with something called social network analysis, which I'm going to give you an introduction to here in a little bit. But I'm really excited to talk to you about how I've incorporated social network analysis into this research that I've been doing, which essentially illuminates the power of community and connection within this magical place. So, to give you the briefest background on social network analysis, it is a theory and set of methods focused on the meaning of connections and social structure. What this allows us to do is we take analytical focus away from individuals and put them onto the relationships between individuals. Most statistics take an individual framework, so we're thinking about individual factors and how that predicts individual outcomes. And in this case, social network analysis actually allows us to mathematically and scientifically consider someone's social context and the relationships that exist within systems. And we get to explore that in a way that we can't otherwise. And so, really, again, the focus here is to understand the power of connections, the power of community, and this gives us a toolkit in which to accomplish that. There's two main approaches to social network analysis, and I wanted to give you a brief introduction because I use both in the work I've done with the Phoenix. The first, it's called sociocentric network analysis. And what that means, it's also code for whole network analysis. And that's when you have a defined group of people and you assess that group of people and the social connections that exist within that defined group of people. So examples of sociocentric networks might be a classroom, an organization, or an institution, a CrossFit class, a specific location of the Phoenix, where you can definitively say who does or does not belong to that network, and then you focus in on that defined group and the connections that exist within that defined group. So I'll talk a little bit about some sociocentric network analysis that we've done with the Phoenix, specifically in Denver and in Wichita. And then we also conducted egocentric network analysis. And the difference here is that instead of having this defined group and the connections between those in that defined group, we're looking at individual egos, and that's a focal point in a network. And we're looking at all of the people that might be connected meaningfully to that individual. So you can see in this picture on the right, there's this obvious central person, this middle node right here. and the different folks who are connected to that middle node. So can y'all see my cursor? Can you see that? Okay. So here you might see this kind of cluster of folks that might be this person's family, for example. And these may be someone's coworkers, and these may be folks they know at the Phoenix or whatever. You have these different groups of people or contacts that kind of belong to different sociocentric networks, but what they have in common is they make up that person's personal network. So both are social network analyses because both focus on the connections between the dots. It's just how we illuminate those networks that are a little bit different. And I wanted to at least give you that background before I keep explaining the studies that we conducted. So you all know this better even than I do, but I wanted to give you a little bit of kind of my origin story and how I ended up with the Phoenix. So before I started working and collaborating with the Phoenix, I had done a lot of research on exercise and I've done a lot of research on social networks. And it came to my attention during my time. I was the director of wellness at Baylor University, and I ran our collegiate recovery program at Baylor. And at the time, working with those students and learning a lot about recovery, I realized that two really important pathways to recovery are both exercise and social support. And this is abundantly supported in the literature, in the scientific literature. We know that exercise helps people both physically and mentally in terms of healing, but also just maintaining a well-being. And we know that social support is the most critical factor supporting someone through long-term recovery. So we know that these two things in isolation are really critical, but I really wanted to know what happens when we mesh those together, which is where the Phoenix came in. The Phoenix is this community who kind of pulls those two things into one really supportive place. And so I was reminiscing, Beth, the other day about like our first conversation ever. Beth had read a paper that I published, which I know was like the coolest thing. I always feel like I write a paper, I publish it, and it's like me, my mom, and my husband who read it. And so it was really cool to hear from someone who had read this work, and she introduced me to the Phoenix, and it was this like aha moment as far as this is where my research needs to go. Because it gets to consider those two things that I had sort of stumbled upon as far as pathways to recovery. So, in summary, kind of what we know and what we don't know, and how what the work we've been doing over the last 2 years has kind of filled some gaps. So, what we know is that social support, very broadly defined, is critical to recovery. That said, so we know it's important, but we don't know a lot of the mechanisms that are important and what yields the social support needed for a positive recovery. We know that exercise is an evidence-based strategy to support recovery. And we also know that community-based recovery support services fill a gap in supporting people through recovery. And what I mean by that, so the Phoenix is deemed a community-based recovery support service because it is available to people in real life, outside of or in conjunction to any sort of clinical or formal treatment. Clinical and formal treatment is wonderful and serves a really important purpose. It is not for everyone. It's not even accessible to everyone, and its efficacy is less than optimal. What we're finding in the literature is that these spaces like the Phoenix that meet people where they are and can do that throughout the course of their recovery, that's kind of the secret sauce, not necessarily just meeting someone when they're at their lowest, but supporting them through the process. So we know these things. What we don't know, and where my research hopefully is going to help come in, is what makes a social connection more or less supportive for someone in recovery? How might that change over the course of someone's recovery journey? Do environments like the Phoenix that combine exercise and community yield the support needed for recovery? We know this anecdotally, but we don't necessarily have the data to support it yet. Although, spoiler alert, now we do, which is really cool. And then how social networks may facilitate that process of recovery and mental well-being. So getting a little bit more specific about what forms of social support and what structures within social networks are going to be important for these things. So that leads me to these overarching research questions that I posed that we're answering with the studies that I'm introducing to you guys today. The first question that I asked was, what drives supportive social connections for Phoenix members? What explains them? What factors are important for them to exist? Like, how can we get a little bit more specific about social support? Because if we know more about what drives them, we can set that up for people a little bit better. And then my next question was, does the Phoenix create an environment that yields social support? And I put 3 stars next to it because the important distinction here is that we know that this happens. Anecdotally, I've gotten the privilege of getting to speak to so many of you through this. And anecdotally, we know that this is happening. And so my quest was just to put data behind what we already know is happening and put some empirical evidence behind the anecdotal evidence that exists. So again, I kind of introduced these 2 approaches to social network analysis, which I've integrated into the partnership with the Phoenix. So there's 2 kind of studies that I'm going to explain here. One was an egocentric network study, which again is that there's a focal individual and we map out their social connections. In this case, sorry, I have to move your faces because you're covering my slide. All right. The egocentric study, we have 79 people who participated. They participated in in-depth interviews with the research team. And basically, we measured each participant's unique personal support network. The caveats to this was to be included in the study, this person had to be in recovery from a substance use disorder, and they had to be involved with the Phoenix specifically through some sort of group exercise type of program like CrossFit. So our participants represent a bunch of states across the United States. They're, all kinds of different Phoenix programming, but not specific to necessarily one location. And then the other study I want to talk about are these specifically happened in Denver and in Wichita. So they were Phoenix members active in the Denver and Wichita CrossFit program specifically. So in this case, we had this defined group of people, one in Wichita, one in Denver, and we measured the connections that exist between those members and how they may be important for people's support provision and recovery. So in this case, we actually have 2 different networks. In the egocentric study, we have 79 networks because every individual involved in the study has their own network. And then in the sociocentric study, we have these 2 defined networks, one in Denver and one in Wichita. So some major findings. I could go on and on and on all day about the methods and analyses and that kind of thing, and I'm happy to answer those questions. But I wanted to kind of skip over to the good part and let you know what we figured out through these studies. So the first kind of major finding is that Phoenix members support Phoenix members. So this finding was out of the egocentric study. What we learned was that participants received more support from network members who were also Phoenix members compared to those who were not Phoenix members. So again, in that egocentric study where you have an individual and they're telling me about all these different folks that they're connected to, when I ran the analysis, it was the dyads that were Phoenix member with other Phoenix member that had the most support provision compared to any other type of network member in that person's personal network. So regardless of how many Phoenix members there were, even if it was only one, that relationship provided the most support to the individual. So that answers this question. What drives social support for Phoenix members? Well, according to our egocentric network study, connections with other Phoenix members drive social support. And so a takeaway from that is, as advocates and as people who love the Phoenix, helping people connect with one another is going to translate to them being more supported, which we know is related to better recovery outcomes and just well-being in general. The next key finding, I think this is super cool. There's a dose-response relationship between engaging with the Phoenix and social support. So this was also a finding out of our egocentric study. One of the things we measured was how long someone had been a part of the Phoenix and how often they attended. And we found that the greater dose, specifically the longer someone had been a part of the Phoenix and the more often they were involved, the more likely they were to report social support provision from their networks. What's really cool about this is it's not specific to Phoenix members. The more that someone was involved with the Phoenix in general, the more they perceive support provision from their entire community, from their entire personal network. And what this is telling me is that the Phoenix is arranging someone to be in a space to be supported. There's something about being a part of the Phoenix that's helping them gain support from their entire networks and build support networks that will help them through their recovery, which is awesome and super cool if you really think about the Phoenix being a vehicle for that. So the research question here, does the Phoenix create an environment that yields social support? From our egocentric study, I would say yes. The longer someone's been a part of the Phoenix and the greater their dose to the Phoenix, the more support they experience from their social networks at large. So something supportive is happening in this environment. Next finding, and I haven't gone into psychological safety yet, I will here in a second, but this concept called psychological safety is associated with social connections and support within the Phoenix. So psychological safety, wow, sorry, briefly defined is basically someone's willingness to take risks and ability to either succeed or fail, but still be welcomed back into the same group. Um, the Phoenix Research and Evaluation team has really prioritized this concept of psychological safety. We figured out that there's something really important about this concept as far as making the Phoenix a welcoming and supportive environment specifically for recovery. And that was true in our sociocentric study as well. So, what we found, we measured psychological safety among our participants, and members in Denver and Wichita who reported higher psychological safety scores also reported more supportive connections within their respective networks. So if you look at this picture, I really like this picture because I think it kind of drills it down or brings it home. So these darker, larger green circles, those represent people with higher psychological safety scores, whereas the lighter and smaller circles represent people with smaller psychological safety scores. And you can see generally there's a trend here that these dark circles kind of hang out more on the center of the network as opposed to the lighter circles are a bit more peripheral. Now, this was cross-sectional, so I don't really know what comes first, the chicken or the egg. That is to be determined with more data and more analyses. But my guess is that as people become more connected and experience more psychological safety, it's this like feedback loop. They're able to connect and support one another more. It constantly feeds each other. So I feel more psychologically safe, I'm more connected. I feel more connected, I'm more psychologically safe. I think those two things are happening in conjunction with each other. So the question, what drives social support for Phoenix members? From our sociocentric analysis, psychological safety does. Phoenix members who experience more psychological safety were more connected within their Denver and Wichita networks. And then a big one and a kind of a final key finding is that mental health really matters. This is not surprising. We know that mental health is such an important part of the recovery process and just well-being in general. But according to our sociocentric study, greater psychological distress, so people who had higher psychological distress, had higher odds of sending a tie within their Denver and Wichita networks. I'm going to show you a picture that helps make this more concrete. So they were more likely to connect out with other people. On the other hand, people who had lower psychological distress had higher odds of being connected with or being sought after. So in other words, people who reported more psychological distress were more likely to nominate other Phoenix members who went above and beyond for them to support them. And people who reported less psychological distress were more likely to be deemed above and beyond supportive. So let me show you a picture of this. So here on the left is a graph. I'm not going to tell you which one it is, Denver or Wichita, because just for anonymity, you probably couldn't figure it out anyway. It's okay. But here we have on the kind of the periphery of the network, you see these red circles, these darker red circles. And these are folks who had higher psychological distress, meaning poorer mental well-being. And the lighter pink and white dots, those are people who reported lower psychological distress or a little bit improved mental well-being. And so what's happening here is that the folks with the dark red, they were more likely to reach out to people in Wichita and in Denver, which I actually think is a really, really important thing, because that to me suggests that people who need it the most are safe to reach out to folks in their networks at the Phoenix. On the contrary, the people who had lesser, lower psychological distress, they were more central in their networks, meaning there's likely something happening, that the more connected someone is in their Denver and Wichita networks, the better their mental health seemed to be. And they also seem to be the people that were sought after for support, which I think makes a ton of sense. That said, we can calculate mathematically different network positions. And so a periphery, network periphery is one of your network measures that you can calculate. And so relatedly, we found that greater psychological distress was just related to being more peripheral in the Wichita and Denver networks. So I guess three things are happening with mental health. Higher distress was related to seeking more support, which I think is great. I think that says something about the Phoenix. Lower psychological distress was related to being sought after, being key influences and sources of support. And psychological distress was related to being more peripheral, whereas psychological well-being was related to being more central. So there's some sort of social thing happening with mental health here. So the question is, does the Phoenix, I'm sorry, your faces are blocking me again. Does the Phoenix create an environment that yields social support? And I think these findings would tell us yes, that people who need it the most are those seeking support the most. Being more integrated into the Phoenix is related to mental well-being. Oops, sorry, I skipped. Okay. So, in summary, our four kind of big takeaways from these social network analyses. One, Phoenix members support Phoenix members. Connecting Phoenix members with one another is a powerful tool and just a reflection of the power of this community. Two, there's a dose response relationship between engaging with the Phoenix and social support. Being involved and being more integrated into the Phoenix meant better social support provision across networks, which again, we know is so critical for long-term recovery. Three, figuring out how to create environments that foster psychological safety may be a means for driving supportive social connections between people. And I think that Phoenix is really kind of setting the stage for this and is leading and pioneering this concept. And so our data suggests that that needs to continue. And then finally, evidence shows that the Phoenix is a safe place to seek support and that creating community could result in mental well-being for Phoenix members, which again, we know is such a critical piece of recovery and well-being in general. And I think the biggest takeaway is that the connections people make here really do matter. The community that exists here is powerful and one that should be celebrated and continued and supported. So that concludes my presentation on this research. So thank you for joining me today and listening in. I'd love to answer any questions if you have any.
Yes, thank you so much, Meg. So Beth did have to pop off, but she and I will stay on, Meg and I will stay here, answer your questions. Feel free to drop those in the chat, or you can come off mute and we can spend a little bit of time going from there as well.
Yeah, Chris, I'm catching up on the chat. He said that I'd love to learn more about the finding that longer time with the Phoenix increases support from all networks. I have a hunch that being part of a supportive network increases one's capacity to recognize and accept support from others in general. And that was put so much more eloquently than I did. So thank you, because that was my hunch too. I feel like there's something that's learned and appreciated in the Phoenix that allows us to translate outside the Phoenix. That as someone's a part of a supportive network within, they also recognize it outside, and also build the networks that they need for support. And I think the Phoenix is an example of that. But okay, Beth said, oh, I guess she's responding. I'm sorry, still catching up. I wonder if it's also partially as you become part of a supportive community, you start to want more supportive people in your life, so your network starts to change. So she kind of commented on the same thing that I said. Yeah, I think those were the main questions. But anyways, any other questions you guys have? I know we're over time. I'm sorry about that.
Well,
I'll
if,
come off.
oh,
Oh,
no, go. Let's hear it. Thanks, Chris.
oh, just a quick one. Hey, I'm Chris McCrimmons, he, him. I'm actually a volunteer manager for Phoenix down in Houston, and you know, I really am probably biased because I'm in Houston where we don't have a facility, but I'm also curious. I would be curious to see further research on the networks for in locations that don't have a physical building or some type of physical presence. I think
Yeah,
that'd be interesting to see whether these results carry through and do similarities and differences.
For sure. And that's you're ahead of me. That's kind of the next step. It was an easy start with Wichita and Denver having kind of brick and mortar programs, but so much of the Phoenix is outside of brick and mortar and, within using programs either through CrossFit affiliates or just through communities and things like that. And so that's kind of my next objective is to see if these findings translate when you don't have a brick and mortar building. So maybe we can chat at another time and talk about because you're right down the road from me in Houston. So that would be a great spot to partner if you're interested.
Oh, most definitely. Yeah. Well,
Yay,
we'll have to reach out and connect. I'll
for sure.
send you
Be
my
so
details.
fun.
Yeah.
All right. If we don't have any other questions, no worries. We'll probably just go ahead and end the